Hi, I am so delighted to meet you in the program of 1 minute please. What is lipoprotein A? Lipoprotein A is considered an independent and established risk factor for atherosclerotic cardiovascular disease and coronary artery thrombosis and stroke, even for valvular aortic stenosis. So, what really it contains? Lipoprotein A is considered as an almost a variant of LDL, but it differs from LDL with the presence of apoprotein A. You are all aware that any lipoprotein structure, including HDL or VLDL or chylomicron, they should contain some amount of apoprotein in the outer ring. The core particle always contains cholesterol ester and triglyceride, but in the outer membrane you must have one apoprotein. In lipoprotein A, you have apoprotein A. What is the clinical significance of apoprotein A that is present on the lipoprotein A? Apoprotein A mimics plasminogen, so it interferes with plasminogen in binding with its receptor, resulting in thrombosis. Apoprotein A promotes calcium and cholesterol deposition over the cardiac valves, especially on aortic valve, resulting in valvular aortic stenosis. Apart from that, lipoprotein A contains oxidized phospholipids, due to which it has 6 times atherogenic potential as compared to LDL. So, as a overall, it promotes thrombosis, it promotes atherosclerosis, it produces valvular aortic stenosis. So, what is the normal level of lipoprotein A? So, generally, it is considered that always it is better to have less than 14 milligram DL as a safe one, but if it is going beyond 50 milligram per DL, then that has to be treated. Please remember that the adult level of lipoprotein A is attained at the age of even 5 years. Lipoprotein A level can't be influenced by diet and exercise. It can be reduced by only means of medication because of its genetic determination. To whom it is supposed to be screened? 1. Those who have recurrent cardiovascular event despite on statin therapy. Those who have cardiovascular events without any risk factors. Those who have history of premature cardiovascular disease. Those who have family history of premature cardiovascular disease. Those who have futures of familial hypercholesteremia, they may present with cholesterol level, LDL level around 500, 600 with all kind of xanthelasma. These candidates generally deserve for screening for lipoprotein A. So, what is the treatment for lipoprotein A? The standard therapy lowering dyslipidemia, I mean the statins have mixed results. The most of the results reveal that it is not much effective in bringing down lipoprotein A. In fact, PCSK9 inhibitor has promising results in bringing down lipoprotein A. It is able to bring down lipoprotein A by 20 to 30% from the baseline value, but it is injectable form, it is quite costlier. And niacin, yes, niacin is capable of bringing down lipoprotein A somewhere around 20 to 30%, but only one important concern about niacin is its side effects. It can produce flushing, it can precipitate hyperuricemia, it can precipitate hyperglycemia. So, you can start with 500 milligram, then you can step up to 3 gram per day. But there is something called ASO therapy, that is called antisense oligonucleotides, where the engineered modified DNA can have impact on the mRNA, resulting in reduction of apoprotein A synthesis. So, but it is yet to come in the market. It has been estimated that it is able to bring down 80 to 90% of lipoprotein A. So, the take home message, lipoprotein A is genetically determined, not influenced by your diet and walking. Lipoprotein A should be screened at least once in our lifetime, even though it should be screened for high risk group. And please remember that lipoprotein A is 6 times more atherogenic potential as compared to LDL. Thank you.